Even as vaccination rates continue to increase daily, new COVID-19 infections, hospitalizations, and deaths are all on the decline in Guyana, marking a significant turning point in what was considered a widespread Delta surge several weeks ago. The deadly and highly transmissible Delta variant was suspected to be behind a steep rise in COVID-19 deaths among adults and children, hospitalizations, and cases. Although health officials did not confirm the presence of the variant locally by sending patient samples abroad to be tested, nationwide vaccination campaigns were being rolled out to aid the country in achieving herd immunity. Moreover, mandatory vaccination requirements to access public buildings and, in some instances, to earn a living has resulted in over 388,444 persons accessing first doses of the jabs, and more than 255,000 persons being fully immunized. Minister of Health Dr. Frank Anthony, during Wednesday's COVID-19 update, noted a change in the way the Delta variant now operates.
The variant that continues to circulate in is Delta, but I think because of our levels of vaccination, especially in Region 4, which has now one of the highest levels of vaccination, that we would have seen the cases being reduced. And we would have also seen, because if you have less cases, you would have less hospitalization and less deaths.
He pointed out that despite several efforts to encourage persons to get vaccinated, those who have chosen not to take the jabs are the ones likely to die from COVID-19.
Unfortunately, the people who are coming into the hospital now are predominantly people who are unvaccinated. So the unvaccinated, they are getting a more severe form of the disease, and they're ending up in hospital. And of those a subset of them, the disease would be so severe that they're dying from COVID.
Vaccination rates are presently slow among the 12 to 17 age group, according to the minister.
But the out-of-school youth, I think we have been struggling to get them to get their vaccines. And so I think one of the things that we have to do is to get parents more involved.
He further added that recent data have shown that adults in the 18 to 40 age range are not sufficiently being vaccinated.
The group that we are worried about, where we've seen relatively low uptake, would be the 18 to 40 age group. That's something because the numbers are relatively low in that age group.
Vaccination sites across the country are currently offering second doses of the Sputnik and AstraZeneca vaccines, first and second doses of the Pfizer and Sinopharm jabs, and a single dose of the Johnson & Johnson vaccine. Temika Rodney reporting for the HGP Nightly News.